Hello, everyone. My name is Nikolay Lunchenkov. I'm LGBT health coordinator at ECOM, Eurasian Coalition on Health, Gender Diversity and Human Rights. I'm a medical doctor, I'm a scientist, and at the same time, I'm a doctoral candidate at the Technical University of Munich in Germany. So today I would like to present the findings from the study that we conducted in Eastern Europe and Central Asia, and to show the importance of working regarding the mitigation of impact of COVID-19 pandemic on LGBT individuals in order to support and help with access to health services, including harm reduction services. So I'm going to turn on my presentation right now, and then we can proceed. So today I will just discuss and show some interesting findings from the big study we conducted. I'm going to talk about this study precisely in a couple of seconds, but I would like to focus on a topic, the association between financial insecurity caused by COVID-19 on alcohol consumption and substance use behavior among LGBT individuals in Eastern Europe and Central Asia. Before we start, I would like to give tell a couple of words regarding the organization that conducted this study, ECOM, the organization where I work. And we're, okay, let me just see. Yeah. So we're international non-governmental association based in Tallinn, Estonia. We are a membership association open to non-profit organizations and activists working in the field of rights and health of LGBT communities in Eastern Europe and Central Asia region. We've been working for quite a lot of time, long time already. Primary focus is promote information about HIV, support access to treatment, prevention, PrEP, including, as well as to advocate for changing in some policies, laws, and in order to abolish discriminative and stigmatizing laws or policies in countries in this region. And of course, when we are talking about the whole broad spectrum of all of the activities that we do, research is one of the main and what is a very important part of the work of ECOM. And we try to use this data not only to generate data sets for providing publications for scientific communities, but use so-called evidence-based policy-making process. So we actively use our findings and our data in order to support advocacy processes in countries in order to change some existing policies. And of course, we also must to react on public health situations or just health-related situations that happened not only globally and region specifically. And as for all of you know, COVID-19 was a huge crisis during the last few years. And of course, we consider this topic as extremely important in order to understand how the pandemic, how the things has changed in the region. And that's why we already know that COVID pandemic dramatically impacted the health and substance use behavior of different populations globally. I don't know if my camera is frozen, but okay. Social policies and general atmosphere in Eastern Europe and Central Asia tend to be homophobic and discriminative. That leads to the exclusion of individuals from social protection programs. So once I will present the results, you will see that quite a lot of people were not able to get access to treatment, testing services, or financial support services because they were at risk of experiencing stigma and discrimination. And importantly, especially at that moment when we conducted this study, information about the impact of COVID-19 in the region was limited, and it's still limited. There are just a few studies conducted by our beautiful colleagues from Hornet, for example, who did a big survey, and we cooperated with them on that too. But specifically investigate that's something which is still not on a high demand, let's say. And the study aimed to identify the association between financial insecurity and substance use during the last 6 months of the pandemic. Of course, because it was, and I will talk about the design, it was a survey that aimed to understand only this question. It was one of the research questions. We also wanted to see how behavior of people, sexual behavior, substance use behavior has changed over the pandemic. Whether they had any issues regarding the access to harm reduction services, HIV prevention services, sexual health services. We tried to understand whether our study participants experience any mental health problems caused by specifically the pandemic, and also how COVID and COVID-related measures like self-isolation or lockdowns influence on intimate partner violence. However, in this study, I will not cover this, and in this presentation, I will not cover these specific topics. I would like to focus on specifically financial parts and also substance use behavior. And also, before we move to the next slide, I'd like to remind our participants and people who watch us right now that I will give approximately 10 minutes to ask questions regarding the study, the situation, and I hope that we will have a very juicy discussion afterwards. So for this study, we used the so-called mixed methods approach. So it means that the study was conducted in 2 parts. First, we conducted a group of interviews in targeted countries, and the targeted countries were Kazakhstan, Kyrgyzstan, Armenia, and Georgia. Kazakhstan and Kyrgyzstan, they are like 2 countries located in Central Asia, and Armenia and Georgia in Southern Caucasus. And the first interviews, like group of interviews, were conducted among LGBTQ plus communities in order to use the findings for the contextualization of major findings from the cross-sectional study that we conducted in June-August 2022. Some of you may argue that at that time there were no precise restrictions regarding the COVID-19 pandemic, and you might be correct with that opinion, but it was very important for us to assess how the situation influenced in the past. And we know with the COVID, the situation might change very rapidly, and especially when we see the lack of, for example, vaccination. So the vaccination coverage was not so high, like in some in our regions, not that high as in some other countries in the world. And our survey that we pulled during this time frame included information regarding their social demographics, economic outcomes, and changes in sexual and substance use behavior, and as many as all the things that I mentioned previously regarding the IPV and aspects related to access to harm reduction and health prevention methods. At the end, we use multivariate regression was applied to identify association between specifically substance use behavior, namely recreational drugs and alcohol consumption, and economic outcomes. And I will talk about the results on the respective slide. So next slide. Yeah, so here you can see the demographics. So the majority participants we gathered in Kyrgyzstan. Regarding the data collection methods, we used community members, community-based organizations that are partners of ECOM's network. And we asked them to help us find study participants for the study. We use this recruitment method by several reasons. First, we knew that for many people, getting access, getting in contact with community, let's say, with community organizations and getting prevention services would be the only possibility to provide this information regarding the study. And also for us, it was very important to provide financial support both the recruiters and participants. So we understand the financial disparities that happened in the region regarding caused by not only COVID but in general financial instability. So for us, it was highly important to financially support both our community members. You see, the population was quite diverse regarding their gender identity. The majority, almost 60%, identify as cis male. However, we had approximately 23% of females. We also had representation of trans communities. However, we do believe that it's still the area that should be explored widely, and trans communities experience a really big amount of issues regarding the stigma, discrimination, health services, and I think we need a separate study to understand the precise impact of these communities compared with cisgender communities. And if I move to the next slide, we'll talk about some of the findings, again, descriptive findings regarding their, okay, slide should go. Okay, yeah. So mental health disparities, and here you see that approximately a third of our study participants mentioned that during the COVID pandemic, during the COVID times, their level of anxiety increased. So we asked them questions whether they consider the increase of this level caused by COVID, and you see almost third of our sample responded that level of anxiety, general stress and depression increased during the last 6 months of the pandemic. And you see that some of the qualitative interviews responded that, you can see the quote from one of the study participants from Kazakhstan who stated that COVID pushed him down and he had to get up. He needed to figure out how to manage his mental health, and during 3 months he was thinking about suicide. Having all these questions in his head, unpaid loans, borrowed money from friends, and he struggled dramatically with mental health issues. And of course, it highlights how affected the community was during the time regarding the mental health. And one of the interesting findings that we also identified during the interviews with our study participants that despite the increased demand of specific services regarding mental health, the amount of psychologists or therapists that were able to provide specific counseling sessions specifically for LGBT population were really limited. So people couldn't simply find a way to go to talk. And we know that in our region, communities are extremely important because sometimes it's the only way to get some support and information regarding mental health, and also to speak with your peers, especially if you live in oppressing and stigmatizing settings. So on the next slide, I would like to show you how the pandemic impacted their financial insecurity. 42% responded that due to COVID, they lost ability to earn money. So they had some issues with earning money. And nearly one third of our study population mentioned that they experienced difficulties buying food or paying rent. And of course, in our targeted countries, people people have different occupations and professions, and of course, as in many other countries, due to COVID and lockdown, some places were closed, and there was a shortage regarding the salaries. And but the actions from the governmental side was quite limited, so there were almost no proper financial support those who lost their jobs regarding the because of the pandemic. And also, if we see on a safer sex behavior, we see I would say the decrease in access to lube and condoms, as well as decrease of use, was not as bad as we expected. And I think this is exactly the reason why we believe that community-based organizations are so important in Eastern Europe and Central Asia. We saw absolutely fantastic initiatives provided by our partners when they were delivering HIV prevention methods like condoms or loops or PrEP during the pandemic, how they provided toolkits for harm reduction regarding the substance use. So, and that was, because most of our communities in the region, they live under significant pressure and they have to adapt to all of the ongoing crises. We're very happy to see how they adapted and how they were creative in a way, how some of the initiatives that were, for example, created by our colleagues in Kyrgyzstan were replicated in some other places later on after the experience after the war. And yeah, so, and last but not least, I would like to also show how change the alcohol and substance use consumption. You see that there was increase of alcohol consumption. Nearly 23% of our study participants responded they started to consume alcohol more often, and 6% of increase of recreational drugs. And of course, there's like ongoing conversation that we had and still have regarding how substance use behavior change over time, and specifically due to COVID, and some of the findings, we present in our paper that will be parts of our presentation too. So I wanted to highlight these four aspects of changes caused by the COVID pandemic, to show how vulnerable our populations in this region, and also to show that there are some aspects that should be addressed from the policymaking side. So, and after all of the descriptive section, we run multivariate regression. We adjusted to social demographics, and we identified that increased alcohol consumption was associated with job losses and difficulties with buying food. Of course, we're about to conduct a deeper analysis to see whether there is direct association between depressive symptoms, and something is telling me that might be a direct association. However, we need to do more analysis of this data. However, we didn't find the increase in recreational drug use with economic outcomes. And so we see that basically some of the financial insecurities led to the situation when people started to avoid the stress and they couldn't find a place to work. So potentially they could consume alcohol in order to cope with this significant stress caused by the job losses or difficulties in buying food. And at the end, I would like to say that increase in recreational drug use was not associated with economic outcomes. The study findings highlight the vulnerability of LGBTQ+ individuals caused by the COVID pandemic. It adds to the evidence that financial insecurity is associated with alcohol consumption. We saw similar findings from other colleagues around the world. The results show importance of developing economic empowerment programs and increased social protection, which was still and right now is still lacking in some of the countries. We don't have specific funds or places where people could get specific support for specific population for specific needs. And the increase in recreational drug use requires adjusting the existing HIV and harm reduction services and programs and adapt them to new challenges caused by COVID-19 pandemic. I would like to say a huge thank you to all case managers and community members who helped us with that recruitment. They demonstrated outstanding commitment and support to their clients, to their community, and this study wouldn't be possible without their significant support. I would probably stop here, and we have 10 minutes to discuss my presentation, and I'm happy to answer your questions. Thank you. So I think if someone is here, I hope someone is here, you can text your questions or ideas into the chat, and I'm happy to answer them. So please don't hesitate, put your questions regarding the study, and I'm happy to provide information probably that I didn't mention during my presentation. Okay. So I imagine that some of the I see the question. Okay. Nikolay, do we have a question, or I just see the name popped up on the left, so but I don't see specific questions, so maybe you could. Okay. Thank you for appreciation. Yeah, one of the things that we really need to consider in the future regarding the next steps, because this study just gave us the cut of the situation, so we kind of saw like one timeline, one point in time regarding the impact. What would be really important for us is to continue doing this piece of research, and ideally we would like to collaborate with other institutions or organizations that are specifically interested in these research questions. So that would be a huge, a very important and interesting part for us. We were considering to conduct maybe a bigger study with a few time measurements regarding to see how sexual behavior is changing under the influence of pandemic. And again, if we don't see the exact huge amount of restrictions in countries, we still believe might be some significant parts, so significant things that should be considered. And of course, it's also important to discuss about these endemics of different pandemics. So we saw that how things could interfere and influence on each other. Okay, then I think I just could go back on the first slide, and again, please do not hesitate to contact us, to drop an email to discuss potential cooperation, or whether you would be interested to working with our data set. We are happy to elaborate how we can proceed and provide you this information. And yeah, so if we don't have any questions, so maybe we at some point can pause here, and I haven't seen any questions. So Nikolay, I at some point I just see it's great, and thank you. So at some point I just see a tiny parts of the question. I don't see the whole question. Maybe Nikolay, you could post it into the chat. Text me. Okay. Why do you think there is no link between economic hardship and increased substance use? Oh, it's something I was also asking. Like we were really thinking about what could be the reason. So first, I would say maybe it's a change in prices regarding substances. Some of our study participants, especially in qualitative part, they mentioned that they couldn't afford some of the substances because of the increased price, and also because of the close of borders and difficulties with bringing some substances to their countries. So there was distribution in a chain. Again, when we discussed like recreational drug use, we specify certain substances, whether like stimulants or some of the like those that you don't usually use on a regular base. So we didn't include it, substances like heroin, fentanyl into the question. And as one of our study participants mentioned, it's was not fun for them to use amphetamines during during the lockdown. Next question: what was the age demographics? Yes, thank you. The age was the average age was 26 years, 26.4 age. So the population of our participants was relatively young. Yeah. Okay. But definitely, it's something what we need to investigate more regarding the hardship and increased substance use. But I personally believe, yeah, two factors: the increased price and also the situations that people were placed in. So, brilliant. We have 3 minutes remain. So, yeah, I see. Okay. So we didn't run the gender. We didn't run the difference between gender identities. So because this, let's say, the first part of the analysis, and the data set is very rich, right? So we are happy to dive in and investigate more. And again, if you like would like to find this question, we're happy to work on that. For us, it was very important at that moment to understand. So what is the general situation? But obviously, we would need to dive in and see the not only the gender specific, but also some other differences between countries. So in some countries of the participants that participated in this study, there were different, let's say, policies regarding the COVID restrictions, and there were different. Also support systems. In some country, there was like the people could receive financial aid during the lockdown period, which was enough to buy a meal. And it's some these differences that we will definitely analyze as a part of the next steps of our analysis. Yeah. Okay. Brilliant. Brilliant. Um, then probably we could slowly wrap up our presentation. I have to say thank you so much for all participants who joined us today. So it was very important for us to share information about the work that we do and about disparities over our communities, and what is more important, the needs that we must to address with the international community. We again very thankful for our partners who support us with the data collection and provided us their insights and help us with this piece of work, and of course the organizers of the study of the conference. so for giving us this beautiful chance. And I think our time is up, and until next time.